Modalities fall into three categories. The first category would be exfoliation. Exfoliation can consist of microdermabrasion, hydrofacial, enzyme peels, dermaplaning, as well as your ultrasonic scrubber will fall under this category. Usually you will go into your next category, which is a modality that creates an adhesion. That can be microneedling, a nanoinfusion, chemical peels, radio frequencies. These modalities create a wound, which causes the skin to go into a healing process that initiates a natural production of collagen. The last category that you usually will use when you're in your treatment room is the healing or skin renewal modalities. The two modalities that fall under that category would be microcurrent as well as LED light. So once you have exfoliated the dead skin, you have created a wound, you want to create a healing or help increase the body's healing ability, and that's what microcurrent as well as LED light do. And I will go through in the next slides to come of the different modalities and whether you use them before or after. If you want to add microcurrent with a chemical peel, always remember to do microcurrent before you perform any type of deep acid peel. Anytime you are using microcurrent, you are helping to infuse products deeper into the skin, and you do not want to infuse a chemical peel in deeper because it can cause burning to the skin. That's why we ask you to do it before. And remember, the reason you would do it before a chemical peel is because it helps aid in the healing process. Pairing microcurrent with any of the exfoliation modalities, whether it be hydrofacial, microdermabrasion, an enzyme peel, or dermaplaning. Remember, these are a power pack combo because the exfoliation modality you choose will help to stimulate the blood to flow. It will polish off the dead skin. And when you remove any of the dead skin layers, it does help the current to penetrate through the skin better. So do your exfoliation before microcurrent. Microcurrent and LED are a great pairing because LED helps to reduce and soften those fine lines and wrinkles. It also helps to increase ATP. It aids in decreasing inflammation. It increases circulation. It also helps with pigmentation. When you're using microcurrent, you are also increasing that ATP, but you're also working on the muscles of the face. You can use LED before or after microcurrent treatment. Remember, if you use it before your microcurrent treatment, you're warming up those muscles, and you might find that you get a little bit of a better lift. When those muscles are warm, they tend to respond better. Nanoinfusion is a great pairing with microcurrent because nanoinfusion increases circulation, has an instant plumping effect, helps by creating lots of microchannels into the skin. And microcurrent complements this modality because once you've created all those channels and you put on your water-based serum, microcurrent will help to drive those ingredients even deeper into the skin, as well as help to heal the irritation that can happen after the nano treatment.
And you remember, you're also working on the muscles. So with nano infusion, you will want to do microcurrent after the treatment. Microcurrent and radio frequency are a great pairing. Radio frequency uses heat to make the skin think it's injured, so it helps to stimulate collagen production while also tightening the skin, where microcurrent will pair nicely with it because it does help in that healing of the skin as well as working on the muscles. We recommend you do radio frequency first with microcurrent after.
Microneedling is used to treat and improve conditions like acne scarring, fine lines and wrinkles, skin texture, and pigmentation issues. When paired together with MyoLift microcurrent, it complements this modality because of the healing ability it brings to the skin. When we increase the ATP in the skin cells, it can accelerate the healing of the microneedling. You're also able to give a nice lift to the muscles of the face. With microneedling, you'll want to do microcurrent before because it re-energizes the skin cells to heal quicker. But if you use a depth of 0.5 or less and you're not drawing blood, you can do microcurrent after.
Oxygen therapy helps to increase oxygen of the skin. It helps to rejuvenate and give a healthy glow to the skin, where microcurrent will increase the ATP of the skin cells. It is also oxygenating as well as working on the muscles. So when you pair these two together, you will really get a nice instant wow factor, especially if somebody has a special event to go to. Microcurrent can be done before or after an oxygen therapy treatment.
Pairing MyoLift with plasma, there are two types of plasma. There's cold plasma that uses no heat. It's a newer technology that's used to brighten and tighten the skin, helps to shrink pores, and promotes high levels of collagen regeneration. It's basically pain-free, it requires no downtime, and it uses a nitrogen-based plasma current. The other type of plasma pen uses heat and causes tiny spots on the face to help tighten the skin, as well as generate collagen and helps to tighten and shrink pores. This treatment does require downtime. So depending on which device you're using, whether you're using cold or if you're using the heat, you will want to do microcurrent before you do these treatments. MyoLift will be working on the muscles underneath the skin to help tighten. Remember, you're increasing ATP production, which helps in that healing process. And then you're going to use your plasma pen.
Chi's 1999 study proved that redness, irritation, and inflammation of surgically traumatized tissue could be decreased significantly when treated with microcurrent. And related to this same study, the buildup of hardened collagen, which is what makes up scar tissue, was noted to be 3 to 5 times less in tissue that was treated with microcurrent. Further studies also indicated an amazing dispersion of existing scar tissue when treated with microcurrent. So remember, if you use microcurrent in a series of treatments before surgery, the muscle and tissue condition is maximized because of the excessive storage of ATP. When using microcurrent before surgery, you are also helping to decrease downtime. You're enhancing the healing ability as well as minimizing scar tissue. Botox and fillers. It's recommended you wait 2 weeks after any injectables. Microcurrent is a great complement because it will help keep those muscles alive and healthy. When a client is using Botox, Botox is freezing the muscle, while MyoLift is keeping that muscle alive. It is also a great alternative for people who don't want to use injectables. And remember, when you're using microcurrent, it is not affecting your fillers, or is it affecting the natural fat cells in the skin. In conclusion, MyoLift Microcurrent is such a versatile treatment. It can be incorporated with more than just one modality. We encourage you to use combinations of microdermabrasion, LED, and microcurrent, or maybe an enzyme, nanoinfusion, and microcurrent. There are so many different combinations. Be creative, come up with your own combinations. Most of the modalities that you're pairing with your microcurrent are non-invasive and it will help with the no downtime, which is always a great selling point. Microcurrent is not only for re-educating muscles, but it also is a great healer of the skin and also helps to infuse products deeper. So be creative and enjoy coming up with great packages.